we are with Dr. Santiago Gonzalez-Moreno, and we can ask you what are the scientific topic and what about the discussion of the course.
Well, this was the first course of this kind that is held and sponsored by the European Society of Surgical Oncology to promote the knowledge in peritoneal surface malignancy. These are cancers that arise in the abdomen and pelvis and disseminate by seeding into the cavity, into the abdominal cavity. There has been very important advances in the last 20 years or so in the treatment of these diseases, and Esso, the European Society of Surgical Oncology, is committed to disseminating this knowledge so that patients that can benefit from this novel treatment can actually have this treatment. And we need new centers, new programs, and that young surgical oncologists get knowledgeable about it so this can be pursued. So this was the main objective, is to spread out the knowledge about this treatment to persons, to oncologists that are interested in it so that they can start new programs.
What were the major obstacles or difficulties that you had to overcome?
Well, in order to get to do this course, there were not many difficulties other than logistic ones, economic ones, but nothing different from what we do when we start to plan other courses. There was full support from Esso, from the European Society of Surgical Oncology. There was a full support from the Italian Society of Surgical Oncology and from CTLO also. So support has been full for the course. Regarding the treatment and the management plan that we're talking about during this course, which is cytoreductive surgery and perioperative intraperitoneal chemotherapy, there have been certainly a number of obstacles, major obstacles we needed to overcome to get to the point now where this treatment is considered a standard of care for certain peritoneal surface malignancies. And mainly there was the obstacle of trying to find adequate scientific support and to overcome the inertia that many of our colleagues, most namely medical oncologists, have towards change in this field, in terms that sometimes evidence would be there that would support the application of this new treatment, but the medical oncology field in general would like a different type of evidence or different type of studies in order to accept it. That has been very difficult to overcome, but the most important evidence that we can get is that at the end of the day or at the end of the time, a patient that should maybe be dead from a disease that could only be treated with palliative measures is alive now and well. And that is the most striking and important and self-speaking evidence that we can get. And this is not an exception. This is the rule in a number of peritoneal surface malignancies. And for sure, this evidence, which is clear, realistic evidence, has helped us a lot in this, but the difficulty in the scientific community and in the medical oncology community have been important. But I should say that although that happened in the recent past, more and more as our medical oncologists and our colleagues, other surgeons as well, gynecologists, are getting to see the results of these treatments, we're being able to bring them together with us in close collaboration in multidisciplinary groups, and we are now able to collaborate all together for the purpose of the best treatment for this kind of patients.